Well, the problem right now is China is in a very difficult situation because it's controlling COVID through, as you're saying, this COVID zero policy. And most countries, what they did when they were trying to achieve COVID zero, so like Australia, was they were trying to get their population as vaccinated as possible so they're prepared when things opened. And what you're seeing in China is that they've had this period of time, the 3-year period, to get prepared for opening, but they really haven't adequately prepared. And what do I mean by that? Well, when we're looking at the number of people vaccinated, overall in China, the vaccination rate's pretty good. It's 87% or so. But in Australia, the people that are most vaccinated are those that are most at risk of dying of COVID, so elderly folk. In China, it's the opposite. So actually, there's vaccine hesitancy, and the rate of vaccination is lower in people over age 80 than in younger people. So that means that when China opens, there's going to be a substantial number of people dying and overwhelmed hospital systems. And China just hasn't to date done enough to catch up in terms of vaccination. They're starting to, but it's a little bit too late.
Yeah, and that's such a good point. They did say this week that they were going to ramp up the vaccinations of the elderly, but in terms of this wave, they can't necessarily keep it at bay in terms of managing that possible impact on the health system.
Well, China is able to do things that other countries are not able to do. And the rate of boosters of people age 80 and over was only 40% 2 weeks ago and is now already above 65%. So that's really quite remarkable. But when you compare it to Australia, in Australia we have, much higher rates, over 90% in over 65s. So we're just much more protected than China is at the current time. The other thing is the vaccines that have been used in China, they're Chinese-made vaccines. They use killed virus. It's a kind of an old-fashioned way of making vaccines. They're just not as effective. So you have the population less vaccinated, at least those most at risk, with vaccines that are less effective. So there's no way the healthcare system is really ready for it at this point.
Yeah.
So they're kind of between a rock and a hard place.
Does continuing these lockdown measures in any way impact the way the virus is evolving?
So I don't think so particularly. I think when China does open up, there is going to be a lot of virus in circulation in China. But really, billions of people have contracted COVID at this point. And when a new variant evolves, it's a bit of a random thing. So I don't think China opening is going to lead to any new variants necessarily. I mean, it's always possible, but I don't think that's necessarily going to follow. I just think what we're going to see is we're already having issues with some supply chain issues because factories have been intermittently shut down in China. But just like in Australia in January of 2022, when we had a huge wave of COVID and it shut down factories, it shut down grocery stores, the shelves were empty, and we had at one point threats to actually being able to maintain our critical infrastructure. That's going to happen in China, and that's going to affect the supply chain worldwide. So there's going to be a very tough period for China to open up and get through the waves of COVID that are going to occur. A lot of people sick, a lot of people caring for sick people. And we're going to see that reverberate around the world in terms of the effect on the supply chain.
Yeah, something that Xi Jinping doesn't seem to necessarily grasp or particularly put any store in. Nancy, just before you go, we're experiencing a new wave here in Australia. Do you think we should be returning to some of the protection measures at the moment because of this latest wave?
Well, we're just about at the peak of the wave, which means we have the most people with COVID right now that we've had since, probably at least since July, probably since January, quite frankly. And I think it would be good for people to be cautious when they're going out, particularly people that are more at risk. But what I'm seeing is people seem to just be sick of COVID and they want to get on with their Christmas festivities. I think it's just going to mean a lot of people get sick over Christmas. And importantly, the hospitals are going to have a lot of patients in them over Christmas. So, I think we could do more. Do I think we will do more? Frankly, sadly, no. But if you are at risk, if you have someone in your family that's at risk, please wear a mask. I think it's the best thing we can do to try and kind of manage at least our own protection.
Yeah, and that's it's a good advice. As you say, it feels though as if people don't want to go back to those measures. And, you know, there's still this sort of message out there that there are subvariants, yes, but they aren't as serious as the others and that they are weaker now. Is that true?
Well, you know, Omicron's probably as bad as the original COVID, the Wuhan strain, not as bad as Delta, not as bad as Alpha, but plenty bad. I mean, the reason it's milder is because we're all vaccinated, which is great, right? I mean, the reason that we're able to live with COVID is because we're vaccinated, we have elevated immunity. But that doesn't mean that it doesn't have an impact and that we can't lessen it by our behavior. So, you know, I think hopefully the weather's going to get better, at least in Victoria. People can get out more. Start socializing outdoors. Wear a mask if you're trying to protect yourself or protect others. And, you know, testing. And the other thing that's important is we do have effective antivirals. You know, Paxlovid is an effective antiviral. If you take it within 5 days, it more than halves your risk of going to hospital, decreases your risk of dying. Not enough people are getting that drug who are at risk. So that's really important. If people get COVID, they need to test and they need to get on antivirals if they're at risk. So the elderly particularly.
Thanks as always for your time, Nancy. Appreciate it.
Thank you.